Hello, and welcome to this week's Social Work Action Network live stream. This is a meeting that is focused on practice in Britain at the moment during this crisis. This meeting is going to be called Confronting Covid, Practice During Crisis. I'm Rory Anderson. I'm part of Social Work Action Network, but I'm also a Children and Families frontline social worker. I think over the last month, we've really seen in Britain particularly, but over the rest of the world, we've seen an unprecedented crisis, which has caused a lot of tragedies, but it's also caused a lot of ethical dilemmas, but also a lot of practice issues and a lot of problems to the people we work with. I mean, if we think about some of the issues around PPE kits and how this has affected practice quite dramatically over the last few years, particularly in our own services, but also to people who are in care work, care homes, who are in hospitals, and also people even the jobs that haven't been thought about, such as shopping centres where we go to get our food and everything else, is extremely worrying. And if you look at some of the deaths that have happened recently, we've seen a quite sharp increase of people who have died, who are nurses, doctors, bus drivers, and including social workers as well, as extreme tragedies. There's also been a sharp increase in the level of people who have, in care homes, of people who have come into contact with COVID-19, which is in Scotland, where I'm based, is now sitting about 25% of care homes deaths are related to COVID-19. So if we think about the pressures that has happened, that has been amplified recently on social work across Britain, is really amplified by 10 years of austerity, and the focus on social workers responding now is now becoming a very prominent issue. For instance, in Scotland, there's already a child protection inquiry into how services are responding and how quickly people are going to be able to get through this crisis. We've got a really amazing panel of speakers tonight. We have Ruth Allen, who's part of the British Association of Social Workers. We have Mark Harrison, who is on the steering group for Reclaiming Our Future Alliance, which is a service user-led organisation focusing on independent living and disability rights. And we also have BK, who is a representative of Social Work Action Network and is a member of GMB Union in a personal capacity. Unfortunately, we were going to be having Jill Archer, who is the social care and social work lead for Unison. Unfortunately, there's been some problems with Unison's technology, and there's been some sort of attack on their system. So unfortunately, won't be able to join us this evening. We're streaming this live on Facebook. I would really love everyone to put in questions, tell me your name, tell me where you're from, so we can ask our panel of speakers over the course of the evening, because we want to hear as much of the workers' perspective from around the UK as possible to think about how we get through this crisis. So without further ado, I'm going to invite Ruth to come in and speak, and she's going to lead us off.
Hi, hello everybody. I'm Ruth Allen from British Association of Social Workers. Really delighted to be here. Really pleased to be here with Bea and Mark. I'm really sorry that Jill couldn't join us. So what hasn't been affected in social work by COVID would be kind of what I've been thinking about this. We have collected a huge amount of information about the impact of COVID on practice, on people using services, on organisations. Since the start of this crisis, we set in train a rolling survey, which is more kind of, I see it more like a mass observation of collecting information about people's experiences, which we're going to keep running, and it'll be a really, I think, important record. Most importantly for us, it's allowed us to respond to the issues that social work is bringing forward in real time, and to look at where the kind of the hotspots and the themes. And I'm going to talk about some of those. British Association of Social Workers works across the UK, so we have social worker members across the whole of the UK. We're the professional association, we're not a trade union. We have a partner trade union, which is Social Workers Union. And we work to support and promote social work, to support our social workers through advice and representation, to act as a voice of social work in lobbying government, in campaigns, and also to provide advice and practice guidance, and to support development of social workers as professionals as well. So we have a kind of fairly rounded role. What we have found over the last, it feels like a lot longer, but it's, what is it, just over a month, 5 weeks or so, are some themes which I think will probably be familiar with many people. The first thing that came through from our survey and from talking to members and other social workers and other activities was a lot of concern and fear about complete lack of guidance for their own health and safety in continuing to do the jobs that they really wanted to do. And that's continued. The fact that social work doesn't figure really in any of the Public Health England guidance explicitly, the fact that there was little national guidance to frame what social workers should and could expect about being supported and prepared in terms of their own well-being to do their jobs, and in terms of working to explain the situation to the people that they're working with, was an issue right from the very outset. So we provided health and safety and other kind of practice guidance for social workers in those regards, to really help social workers be able to do the jobs they want to do, to be able to have conversations amongst themselves, so groups of social workers being able to get a shared sense of what good practice and what safe practice could look like for them and for the people they're working with now, and also to be able to talk to their employers and to be able to hold their managers and their employers to account around what good practice looks like in this situation. So that's one of the key things that we've been working on. We work with social workers who are in every part of all parts of practice, all fields. So child protection, adult protection, working in mental health, in other parts of children's services, in the voluntary sector, and independent social workers as well. And of course, all have been affected. In mental health, we did quite a lot of work early on, and with this, working with the representative from the Department of Health and Social Care, Mark Trewin, who leads on mental health social work, and working with the AMP Leeds network. And really what we did there was a model for what we tried to do to support practice in other fields as well, collaborating with grassroots organisation for AMPs, which is the AMP Leeds, with practitioners, with DHSC, about how we could improve the support for AMPs, and to look forward to helping to prepare practitioners for the changes that were coming up in legislation, or that were proposed. At that point, we were looking to the potential implementation of the Coronavirus Bill, which of course now is an Act, and that's brought in a number of significant changes for social workers. The changes to the Mental Health Act was one that we've been working on and looking at the implications of that, which has stripped back some of the rights and checks and balances. It's not implemented yet. And I think one of the issues for practice is social workers understanding what is and what isn't been put into operation, what's been enacted, what's changed and what's not changed. And then, of course, the other part was the easements to the Care Act in England. So, and similar changes to legislation around the UK. And so we are very aware that social workers now are potentially having to work to new legislative frameworks. So we've done a lot of work around the implications around the Mental Health Act, which are actually not as great as the potential changes around the Care Act and adult social care, to try and ensure that the first thing I should say is that we made clear representation when the bill was going through about the fact that the Care Act changes were going to strip out a lot of rights and a lot of expectations that people using services have, and that was it was pushed through in very short order, which I think for practitioners on the ground is really it was very difficult to see in some ways. And I think there's a lot of fear that the changes to the Care Act and the so-called easements and stripping out responsibilities and legal duties and turning duties into powers within local authorities. A lot of concern there about what that would mean for disabled people's rights, for older people's rights. In fact, quite a lot of key parts of the Care Act haven't changed. But again, I think it's very confusing for people on the ground to understand what has and what hasn't changed. And one of the things that we think is incredibly important is that all organisations supporting social workers, we need to be able to come together and give the advice and give the support that enables social workers to continue to practice in ways that focus on human rights, on justice, on the core of good social work, and that finding a way through to uphold ethics and standards in the midst of what is a very difficult and frightening and confusing time. So on the kind of ethical side of things, it was being mentioned earlier by Rory that this is an ethically very, very challenging time. And that's the other thing that's come through a lot. Social workers have found themselves in ethical dilemmas that are completely new and strange, and having to make decisions that they're very unclear about, and the degree to which it's possible to practice well and to feel confident and to feel that you can be in that job and make those decisions, both decisions about your own safety, about choices that you're making with the people that you're working with. So much of that is framed by how well supported you are by your managers, by your supervisors, by your organisation, whether there's good advice coming through. And right from the very outset, the feed-in that we were getting is that people had incredibly mixed experiences of that. So some people were coming to us and saying, actually, my organisation's been great. They decided we would be working from home. They moved us home. We got the equipment that we needed when we needed to go out on visits. It was clear how we were going to achieve that, and they helped us deal with some of the ethical and practice concerns we've got. For instance, in child protection, I'm sure Bea will talk more about this. How do you stay close to families? How do you keep in touch with families and continue to support them? How do you ensure that you're directly seeing and working with children in situations of lockdown and stay-at-home policy? So we've had very, very mixed feed-in, and a lot of people feeling really quite desperate about how they're being treated by their employers, to be fair. Not everybody, but a lot of people. And one of the things that so being treated in the sense of either having a lack of clarity, a lack of support, or feeling they were being asked to go into environments where they were very unclear that the infection risk to them or the infection risk to the person they're working with was being properly supported and properly managed. So so helping people to kind of deal with that has been very important to us. We run an advice and representation service. We're talking with 50% more people every week now through that, and the majority of those calls are COVID related. One of the things that has come through is that agency workers often feel particularly vulnerable at this time, and finding that and this is, at the moment, it's quite anecdotal, but it would be interesting to see if this is a kind of theme where agency workers are feeling like they're getting less good support, less good advice, being asked to go into environments which are more concerning, or where they have less kind of control over the work they do. So that's something that we're very keen to keep a very close eye on, and how we can support agency staff in this, which we think is probably quite a major issue. The backdrop to all of this, of course, is the fact that all adults and children's, all of social services, all of social care, and the health system as well, have been massively underfunded and under-supported for a very long time. And you've got both the austerity impacts on services and on staffing numbers, on things like administrative support, all of the panoply of those things, which in some local authorities in particular have been so stripped out. So there's that kind of weakening of the overall social care and local authority support structure to communities. But also the impacts of on our communities, of austerity, of insecure work, of people on universal credit, people in poor housing, and all of those matters adding into huge amounts of family stress. And so we're very aware of that, and the way in which COVID will impact different parts of the community differently, depending on the resources that households have, the living conditions they have, whether or not people have retained work, whether they've retained work in a safe way, or whether they're having to put themselves in harm's way because of needing to go out to work even when that's difficult. So we're very aware of that, and that is coming through as well. And social workers feeling really concerned that their working circumstances are maybe not letting them get close enough or stay close enough to the people that they want to serve. And I'm just going to finish now by saying the other thing that that's come through a lot is that there are collateral harms from lockdown, which we're seeing with a rise in domestic violence and a rise potentially in different kinds of mental health impacts. So we're very well aware of that. And again, I think all of those things have implications right now for practice, but they also have implications for what social workers will be dealing with in coming months.
Thank you very much, Ruth. And I think you raised a couple of really important points. I think the consistency and the feeling of uncertainty for workers in terms of how they're coming and going, in terms of that decision making and being known what to do and how people are responding in various organisations and various authorities, obviously can't be linear across the board because it's dependent, but there is a real sense of uncertainty of what we want to do and how safe we are being able to practice alone, and especially thinking about things like child protection, where there is duties for workers to be in and about the families a lot, and how this increases it. I think the other thing you mentioned there that I thought was quite important is the impact of austerity here, and showing how unprepared a lot of services haven't been for this, because they have been weakened. They have been, essentially trade unions have been weakened quite a bit over the last 20 years as well, and thinking about what strengths do we actually have, and now get to this point where we're supposed to be in a laissez-faire term, national unity, we'll say, but at the heart of it, what we're seeing is workers who've been under severe pressure for a long time, particularly NHS workers and care workers, especially low-paid workers within care work, who are underappreciated, have now become key workers and are now the most important people in society, who have been undervalued for such a long time. And I think it's a really important point to bring in at this moment that next week there's going to be a Workers' Memorial Day on the 28th of April. And Workers' Memorial Day is really set up to discuss remembering people who have passed away, workers who have passed away, but it's also about fighting for the people who are living. So we're going to be having the phrase, remember the dead, fight for the living. We have to mourn during these times for the people who have passed away and the tragedies that have happened. We also have to fight so that no others die during this period. Various things will hopefully happen during this. We all have to continue practicing social distancing and maintaining distance from people, but can you make signs? Can you hang them out your windows? Can you be loud on your street? Can you be loud on your street? Can you get chants going? I think this is the time to actually try and unify people in communities, also in our workplaces, and show that things need to change for the good, and going back to normal is the problem. We need to think about the future. So I'm going to bring Mark in. There you go, Mark. Well, you muted yourself. Give me a second, Mark. You muted yourself. I think you've muted yourself, Mark. There you
go. Okay. Thank you for inviting me to take part in this public meeting. I'm speaking on behalf of Reclaiming Our Futures Alliance, which is a disabled persons-led alliance of disabled people across England and disabled people's user-led organisations. And we work very closely with our sister organisations in Scotland and Wales. And I'm going to speak more about wider policy issues rather than direct practice, although obviously it will impact on practice. And I'm going to particularly focus on social care and independent living. And not just focusing around COVID, but thinking about what comes after COVID, because this dreadful pandemic, which is causing so much grief and death, may provide opportunities for a recasting in a positive sense of the social care system and independent living. The Chief Executive of Age UK accused the government the other day of airbrushing older people out of the pandemic as if they don't matter. And I think the pandemic will probably be remembered for its outcomes for social care users in general and care home residents in particular. And this is going to be a national scandal on a scale that we've never seen before. Because as the post-virus investigations and recriminations take place, it's very clear from all the statistics that are beginning to come out that deaths in care homes are likely to be around 50% of the deaths in the pandemic. And the World Health Organization regional director said that's the case right across Europe. And I suppose what my feelings are is that we can only guess at the level of suffering in care homes. We don't even know how many people are dying. We don't know how many staff have the disease, and we don't know how many staff are dying. And you know, many of them will share the same fate as the residents they're caring for. In the week before Easter, the only government statistics that we had that were released on Tuesday said that 1,600 people had died in our care homes the week before Easter. All the comments I'm making aren't in any way a criticism of social workers, social care staff or NHS staff who are working in extremely difficult circumstances. And I think it's really important that we make common cause between disabled people of all ages who are users of social work and social care services and the staff that run those services right across the UK. And I think the situation is probably worse in England, certainly, than in Scotland, in that austerity has hit longer and harder in England. And that's our experience in the disability movement. So my criticisms will be of social care management and social work management, who have often uncritically cooperated and imposed austerity cuts on disabled people and those who are eligible for adult social care. And they've even developed models of thinking to justify these cuts. And disabled people are very critical of some, for instance, the 3 questions model, which seems to be a social work practice for austerity, because it frames expectations for people in crisis and families to manage their expectations of what they can expect from the state, and is used to justify care packages, cutting care packages for existing and long-term service users. So in 10 years, the government and management of social care have destroyed the choice and control and the progressive side of personalisation and direct payments fought for by disabled people for so long. And you know, it's really important to note that, you know, the implementation of personalisation of direct payments came about through a close alliance between disabled people and service users and progressive commissioners and social workers. And they've replaced it with resource-led minimalism. And the commissioners particularly, and the government cuts have seen their sharpest impact on people with learning disabilities and autism who have been imprisoned in so-called assessment and treatment units. And we've seen that with the Panorama programme in 2012, nearly a decade ago, the sorts of abuse that goes on in those institutions. And that was reiterated again last year with the Panorama expose at Walton Hall. And I believe that, you know, and after the 2012 scandal at Winterbourne View, the government committed to closing all those institutions and relocating people back into the community. But today, there are still more people in those institutions than there were in 2012, despite, as I say, recurring scandals like the Walton Hall scandal last year. And I think that, you know, from the evidence locally here in Norfolk, where I live, the biggest contributing factor to that is the closure of preventive and community-based services due to austerity cuts. That austerity has led to social care, social services retreating to statutory duty and closing all the preventive and community-based services that supported people to live independently, and then handing over the responsibility for people with the most complex needs to the NHS so that somebody else pays, and locking people away in institutions to be abused. And I think this is a crime that is made worse in the time of COVID, because there's been no attempt to get people out of those institutions or get people out of care homes. And we're working with barristers at the moment to bring a judicial review to force government and local authorities to get people out of residential institutions, because residential institutions in many senses are, you know, a death sentence. They've managed to get people out of prison, but the same focus hasn't been on those institutions. The other thing, the more wider policy issues I want to address are around the fact that the social care system is still based on poor law principles of means and needs testing. And the vast majority of social care is delivered by the private sector and outsourced formal local authority services. And much as this provision is stuck in a service delivery time bubble, creating dependency and restricting independence. So most of that provision is located in the private for-profit sector. So after 9 years of austerity cuts in social care and social work, and the arbitrary welfare reform, we've got a system that's at breaking point. So what should be done? Well, disabled people in Reclaiming Our Futures Alliance have created a vision based on the UN Convention on the Rights of Persons with Disabilities, and particularly around Article 19 on the right to independent living. And we're saying that we need to bring social care into a similar model of funding as the NHS. We need social care to be free at the point of need / use. It needs to be funded nationally out of progressive taxation, and we need to it needs to be delivered locally through disabled people's or user-led organisations, community-focused cooperatives, and social enterprises that are not for profit, and taken out of the private sector. We think the Care Act needs to be scrapped, and we need a new legal right to independent living, and we're working with the Equality and Human Rights Commission to do that. But we don't think it should be integrated with the NHS, because we want to move the NHS away from its medicalised model of delivering healthcare towards a much more social model of delivery that exists in social work and social care. So it's contradictory. We need to review the role of the big traditional disability charities and carers charities, which we don't think are either progressive or helpful in this situation. And we think local authorities do have a role, but their main and natural home for the organisation of support services and provision isn't in local authorities. Local government will have a role to play, but it's in the generation and regulation of the social care market. What we want to base our National Independent Living Support Service on is the Independent Living Fund, which the government closed in 2015. And we think that should be reinstated and expanded to include children, working age adults and older people. So those are the key things. All those policies and that vision of a National Independent Living Service is on the Reclaiming Our Futures Alliance website, which is www.rofa.org.uk. We think that's a vision that is sustainable. We think it would free up service users and their loved ones and their families to have the fullest, equal and active life. And it would recast social work and social care for the 21st century, not you know, in the way that it's being treated at the moment as a Cinderella service. Thank you.
Thank you very much, Mark. You raised some really important points about actually knowing how many deaths there are. I think there was an FT article yesterday, that a study that came out that said actually it's probably twice as much the amount of deaths that have actually occurred rather than what's being published, because of the collection of data isn't there. And we're getting lots of comments in on the Facebook page, and I would ask people to keep on sending us your questions so we can ask the panel later on. But someone has raised about writing to Verity has raised she wrote to the Chief Executive about the council should move old patients from hospital to care homes without being tested, makes her feel complicit in spreading the virus. And another important point as well, tonight, every Thursday there's been the clap for the NHS, clap for carers, clap for key workers. And someone has commented here that we should be clapping every night, but we need to turn this into a raging howl against the government in terms of what has happened and their reaction to it. So again, austerity comes into every single point that people are bringing up in terms of the preventative services that were stopped prior to this crisis. But also, again, Verity makes another really good point about, you know, the next time a manager says you can't get any money, then you should be asking, well, how could you pay for COVID? Because at the end of the day, we have to remember that austerity by the Tory government was a political choice, not a necessity. And certainly coming out of this crisis, it looks like, if you read the reports by George Osborne, where he was saying that, you know, we're going to have to use austerity to get out of this. We can't go through that again. It's as simple as that. People can't die the same way they have done over time. We can't ravaged services that we have done, and we need to fight for a better future. So I'm going to bring in our final speaker before we open up to others. We'd just like to say we are over 150, almost 200 people watching on the live event, and that's not including the watch parties that are happening as well. So thank you very much for logging in, and keep on sending your questions into us.
Okay, can you hear me?
Yep.
Yeah. Right, so I've got a sign saying unmute myself. Okay, I think like Ruth and Mark, I want to start with austerity as well, because I think that if you look at the situation that we're in now, in terms of the social care framework generally on the ground, the context of it is that it's extremely fragile because of everything that's happened over the last 10 or 20 years. And I think the other thing that I want to say is that we have to look at social care in its widest context. We can't just talk about what's happening to social workers. We have to talk about what's happening to education workers, what's happening to admin workers, support workers, all of those people, because they are so interrelated in terms of their ability to deliver a service to support children and their families. And I think that for me, the services that we provide have been under massive threat for a huge number of years because of of austerity and because of the attacks that we've seen across the board, which have meant that people have got a lot less job security, their wages have been driven down, and this has meant that the families that we're trying to support have become more and more fragile and more in need of support, at the same time as the very services that are meant to provide that support are shrinking. And therefore the context that even though maybe social workers haven't to the same extent taken a hit in terms of job cuts, the pressure on those workers is massive, partly because of the increased need, but partly because of the weaknesses of the other services around them that are being attacked more and more because they maybe don't have the same statutory duties. And I think those things are very, very important, and to see social care as a whole and not social workers as a separate entity of their own in that sense. And I think the other thing that's important to say is that what we see now is those systems that have been stretched to absolute breaking point then have COVID and all of the pressures from that added to that. So suddenly we've got a huge number of families who were managing quite well before, who are trying to get benefits from a benefit system, which is basically, has got waiting lists as long as you're on. Thousands and thousands of people every hour are trying to sign on to get some sort of income support, etc. And those kind of things will send families spiralling because the pressures on them are so great, as well as that concern that exists about their own health and their friends and their family's health. And I think that sort of mixed together has meant that the pressure on the ground for services is massive, absolutely massive, and very, very frightening for people in terms of the situation that they're in. So I think what we're seeing, I work in children's services, but I think what we're seeing is already a problem with social work careers being extremely short-lived, in the sense that people don't stay around very long because of the workload pressures that are around, and the lack of support, in a sense, in terms of that sense of it in its entirety. And that's now getting worse and worse. And what we're seeing is fears starting to grow about, for instance, the replacement of those social workers, because social workers who are currently training are finding their courses either online or effectively halted. And they're also in institutions where there's been some fantastic industrial action taken. So, for instance, I have a friend at the moment who has signed on, has just started training as a social worker, and in the last 3 months she's had 1 lecture because she supported the university lecturers' strikes, and then this has happened, and therefore she's very anxious because she's saying, how on earth will I be able to train? And the knock-on effect then is, how will we replace and use those people who are trying to train now in terms of future resource, which is very, very worrying. So I suppose in a sense for me, there was very little flexibility left in the system at all before the pandemic started. And now what we've seen is services reaching breaking point. I think that's been most obvious in adult services, and the impact that that then has in terms of families who are trying to support their children, who are seeing mainly women being expected to provide elderly care and care for disabled members of their family, because those services don't exist in the community as they should, as they maybe did before. And we also know that the impact always of the financial and economic pressures on families is to create huge levels of stress, and we're seeing that massively at the moment, in the sense that families are becoming much more privatised and much more isolated, and domestic abuse is soaring. We know that the domestic abuse services aren't there to support families in the way that they'd like to. They were fairly much at maximum before, and the estimates are anywhere between a quarter and a third increase in calls, which mean that the pressure is there, and those families are probably less able now to ask for help, because there's far less outside contact going on than there even was before. And I think the difficulty for a lot of social workers and social work offices, and I include everybody involved in that process in there, is that what we've seen across the country from local authorities is basically a business as usual model. So, an attempt to almost carry on as if nothing is really happening. I know people accept that something is happening, but there's a sense of we have to try our hardest to carry on as normal. Now, that's absolutely impossible, and people are clear about that, but I think it's taken several weeks for managers to get that that's impossible, and to try and start looking at maybe alternative ways of working. And the difficulty is that those alternative ways of working are very hard to reach, because of the ideological attack that's existed over the last decade or so, really, in terms of whose responsibility it is for things like child abuse, instead of society and communities being empowered to take responsibility and support families. It's become more and more privatised and more pushed onto individual families as their fault and their responsibility. And what that's meant then is that there's very few resources out there in the community that can start getting involved or can start to support people and look at different ways to do that in the current period. I think you can add to that high levels of sickness, again across the board. Originally, we had that anyway because of stress and workloads. That's now been exacerbated because of COVID, because of underlying health conditions that a lot of our staff have and their families. And therefore, that pressure and that need to socially isolate and withdraw has increased massively for an awful lot of staff and squeezed the system even further than already we were able to. Those workers that are engaging with families are reporting real mixed emotions about that, a massive amount of sense of responsibility about not being able to go and support children and not be able to do the job that they felt they were doing. Others are reporting that actually using social media, not social media, but, being able to connect with people virtually has been very interesting and very beneficial in the sense of being able to talk to young people and see them on a regular basis. But of course, not every household has got the ability to link up virtually. If you're poor, if you're on benefits, your child may have a phone, but if the phone breaks, you ain't going to get it repaired at the moment. And therefore those connections are very much based on families having income or prioritising those kind of things when they're absolutely stretched. So it doesn't reach to everybody. I think the other thing that we're seeing is instead of accepting that there's a major problem in terms of funding across the board, a blame culture starting to develop, which looks at different agencies and says that they're not pulling their weight. So, for instance, I've heard people say, if schools could just do more, if they could open more, if they could provide a better service for kids, then there would be less pressure on families, without looking at the pressures that are on schools themselves. Again, blaming families that are vulnerable and saying it's their fault because they're not getting their kids into school. Again, without looking at their very well-founded concerns quite often about the fact that schools are not necessarily safe places, because what kind of PPE exists there? Is it possible to socially distance in those kind of settings, etc.? So there's a lot of issues there that people are having to consider and are very serious about, but it's almost like a double standard at the moment, that vulnerable families are maybe not allowed to have those kind of worries about their children. And understandably, there are concerns about whether their family homes are safe, because of the concerns that already existed in that way. And one of the other issues that we found is where some workers have tried to stand up and argue for better things like health and safety and PPE, an approach again from management saying that we do this because we care, and almost alienating staff that say we care, but we want to be fit and well and to protect ourselves and to protect the people that we're visiting, as if somehow that's that's an absurd idea. And actually we think it's very, very central to care to be able to say that we need the right equipment to do that for the families and for ourselves. So we're seeing massive levels of anxiety and isolation. We're also seeing a move from local authorities to ask for staff to be more flexible in terms of the jobs that they do, to fill gaps that are starting to appear. And of course that's then coupled with concerns around training for those staff, around whether those staff have got DBS checks, are they going to go into safe situations, are they going to be under pressure to do things that maybe would not be considered to be appropriate in other situations. So there are a lot of concerns around where that leads us. On a plus side, there have been some very interesting small fights to try and improve situations, and anecdotally we do know where staff are saying we won't go and do visits without the proper PPE, that actually that PPE does appear quite quickly. There is a stock around in local authorities, but what a lot of staff are being told is this is only being kept for emergencies. Well, if this isn't an emergency, I'm not sure what is, in that sense that it's a different definition to the one I know. I think one of the things that's missing for all of us is we need to see a higher profile from our trade unions. I think they're starting now to put out information around health and safety, but certainly more support for workers on the ground in terms of being able to say no and to feel supported and not feel the threat from management that is there if they refuse to work, whether they'll be disciplined or whether they'll be taken off the payroll, because that does exist in some local authorities for definite. And I think the other plus side is to say that as we are getting better organised, social media, virtual, contact is something that we're finding does work. I've been having regular union meetings with my service union members, and actually finding that people are able to talk much more freely quite often because they aren't in an office with managers there that they're worried what might be said to them. And I think this is happening in lots of different areas and is a plus in that sense, and also helps to overcome the isolation that people feel. But I do think that there are an awful lot of fights to come. I think, just to finish, that one of the fears that we're talking about at the moment is the fact that managers in lots of local authorities are now talking about workers starting to go back to work. How can we open up offices? How can we make them safe? We know that IT systems aren't working very well, and therefore there's pressure for people to go into offices to keep in touch. And we know there are an awful lot of fights to come. We know that those fights rely on science and whatever people, the government says is safe, and there's a lot of concern about what science is being used by the government to define our safety, and that will roll out, I'm sure, and play out over the next few months. But I think that the key thing is the crisis of neoliberalism. This has taken the crisis to its end, in a sense, and what we all know is normal is going to be very, very different, but we don't know what that's going to be. And I think we have to fight very hard to frame what the new normal is in order for us to take things forward in a way that feels safe and supported for the families that we serve.
Thanks very much. I think that was really instructive, and I think a couple of the points you pulled out, particularly, we're talking about alternatives to the crisis and raising the actual issue that this is a problem within education, within health, within the voluntary sector, within public sector. This is actually a systemic issue and a structural issue that has developed through COVID, but has actually been going on for quite a bit of time. And some of the issues, the BBC news report about 5% of at-risk children in England going to the schools on the vulnerable lists. There is a marked moralism about what are people doing and why aren't you doing this? And you know that adds a lot of more fear and a lot more pressure onto families who are at risk and who are part of society which is uneven, and feeling more blame and putting more stigma onto them. Okay, we're going to move to, I'm going to bring in some of the questions that our viewers have been sending into us, and I want to say thank you very much. I'm still getting 10 a minute getting fired into me, that's why I'm on my pen constantly. But just before that, I'd just like to say that Critical and Radical Social Work Journal has released free journal articles that you can view while you're in social distancing, while you're in lockdown, and for any students and anyone who would like to read them. You can get the link that will be posted on the Social Work Action Network Facebook page and website, and you can go on there and you can download them. So I'm going to ask a question, and then I'm going to bring in, I'm going to direct it to a speaker just to help us get along with this. And the first person I'm going to bring in is actually Mark. I'm going to ask you two questions because one is more related to yourself. So Verity asks, what is the 3-question model? And maybe a sarcastic question, but quite a good one. Has there been a government response? You've muted yourself again, Mark.
Does that work?
Yeah, there you go.
Okay. The 3-question model, I think, was developed by a number of academics and directors of adult social care. I think it's been rolled out in a whole number of local authorities through ADAS across the country. And it's an attempt to ask potential service users and their families questions to deflect people away from services. And it's also now being rolled out for existing service users. And I think, I think it's part of the, neoliberal state justifying austerity cuts, justifying the lack of services of a small state, both nationally and locally. It's creating real problems. For instance, in adult social care, it's being used to justify huge cuts to social care packages, where people, particularly again with people with learning disabilities and autism and related impairments, are having services taken away, which create independence for them. And it puts the responsibility back on the families and the pressure on the families. And many of the people in these services are older disabled people who live with their extremely elderly parents. And there's no planning for independence for when parents can't look after them anymore. And that's not just the case with older disabled people. There's in Norfolk, we've got a campaigning group, which is a fantastic group of disabled people and parents of disabled young adults who are having their budgets taken away from them, who are being charged for the social care services in COVID that they're not even getting. So because the day centres have closed and the community-based services, but they're still being charged and money's been taken out of their benefits directly by the local authority. This is, you know, a tax on disabled people. So it's an ideological attack, I think, on the principles of social work practice that we all grew up with and take for granted. As far as the government's response, we've seen, you know, in the emergency legislation, the eroding of the Care Act and the, you know, taking away. And one of the things that we're particularly concerned about is the fact that the government, although it's going to be reviewed, I think, every 3 months, have taken emergency measures over the next 2 years. So I think that's very concerning. The government are refusing to talk to disabled people and disabled people's organisations, so that they're, you know, and they're required to do so because they've signed and ratified the UN Convention. They don't talk to us, they talk to non-disabled people, they talk to the professionals, they talk to the disability charities for disabled people. And because I think disabled people have led the fight against austerity through Disabled People Against Cuts, through direct action over the closure of the Independent Living Fund, we reported the government to the United Nations and they carried out an inquiry. And the chair of the Disability Committee said, you know, it was a human catastrophe what was going on in the UK in relation to disabled people. And the UN, in their last report, accused the UK government of grave and systematic violation of disabled people's human rights. And the government was in complete denial, as it was when Philip Alston, who was the UN Special Reporter on Poverty, came and made his report. And they just denied everything and said it was a liberal conspiracy, you know, straight out of the Trump playbook. So we've got no illusions that the Boris Johnson government is going to be any better than the previous administrations since 2010. But they are saying that they're going to develop a national disability strategy. And we keep writing to the minister and asking when they're going to consult disabled people, and they just refuse to do it. So I'm not optimistic. So that's why I was calling for a common cause to join, you know, social workers who are fighting internally for their own rights within local authorities and the rights of their service users, that we need to build an alliance across disabled people of all ages and our allies to really fight this one. Thank you.
Thanks very much, Mark. And it is actually the question I've got prepared for you later on is actually going to tie into that quite nicely. I'm going to bring Ruth in. We had a question from Rebecca. How can we bring the good work that is happening in social work into the public domain at this time? Oh, give me 1 second. Press the wrong button there. There you go.
Okay, thanks. Yeah, it's absolutely crucial, isn't it? I think social workers have had the good work that's done, the work that's done, the fact that social workers are essential part of this much wider network of public services that are needed to provide supports that's been described by colleagues as well this evening. Social workers don't have the profile, and we absolutely haven't been the first. In fact, we've barely been mentioned in most governmental statements, even about social care. Actually, social work occasionally gets mentioned. I think it's really important that we tell the stories of great social work, actually, that we publicise the work that we do, and we actually show and tell the work that social workers do. I'm not sure that we have always done that as well as we could collectively as a profession. It's something we're very committed to. So we're collecting voices of social work through COVID and publishing free articles online regularly, where social workers are coming forward and telling us about the work they're doing, describing their work, reflecting on it, talking about the struggles that they're having, but also the amazing efforts and the way and the role that they have and the distinctive part that they have to play alongside colleagues from all professions and disciplines and parts of the workforce. So I think we need to do that. The danger is that we will continue just to tell these stories to ourselves, and I think that is something that that we have to kind of break through. Getting into mainstream press and media, capturing the attention of the mainstream media is something that we do a lot of work on. I recently, I was on Radio 4, I was on Radio 5 Live, we were in The Guardian, The Times, The Telegraph. Interesting actually about which bits of the press and media are interested to find new angles at the moment on this, which can seem quite cynical, but you kind of have to use that to get stories told, I think, and to try and get people to see what's really going on. And within that, to kind of demonstrate, I mean, like the way I see it is, we're hearing all about public health. Public health policies is allegedly driving the government's response to COVID. I think Bea was making some important points about we're not sure really what science is always being applied. There's different bits of science are being used in different countries in response to COVID. And some of their public health strategies seem to have been much more effective than ours, but time will tell on that really. The social workers have a public health role. We prevent people becoming unwell, deteriorating, because we intervene and support them with disability issues, with older age, with family stress and difficulty. Through that, we have a crucial public health role, and I think it's been so disappointing throughout this, and we've been with parts of public health, written to public health, talked to senior leaders in government about this as well, is that the public health role of social work is missed. There's no public health without social health would be a kind of way of looking at it. And I think we have to use this crisis situation to really demonstrate the difference that social work makes because of our approach, because of the fact that we get alongside people, the fact that we are there to protect people's rights, and by protecting people's rights, we are there to enhance their health in the broadest sense, to enable people to help people to play a fuller part in society and to live the lives they want to live. And that is a public health responsibility as part of public health. So I think we need to tell those stories about the importance of what social workers do, and I think we need to describe what we do every day to support people really well. I think the other part of this is, social workers' involvement in people's lives is not always welcomed. Social workers in the UK have massive amounts of state power, state authority, and how we use that determines a lot of how we're seen, and creates all sorts of ethical tensions about what should be the role of social work. But nonetheless, we're there to protect people who are at risk, and we use those powers in that way. I think this is an opportunity through COVID to actually demonstrate that isn't all that social work does, and even when we do that, we are there to promote the public health of society at large, to try and recast some of those stereotypes that the social work labours under, and getting alongside and being in solidarity with people who use services, and with carers and families as well, I think during this time is really important. So the more that we talk about that, the more that we give visibility to it, whether that's starting off just talking within, providing that within, the trade press, within our magazine or wherever, but that we can build on that and get that seen more widely. I do actually think this is an opportunity in a curious way, but we have to take it and we have to make that visibility. We have to create the visibility and tell the stories of what we do.
Thank you very much, Ruth. This is actually quite a good time to actually raise. Swan Social Work Action Network will be hosting a Zoom meeting coming up on the 7th of May, where it will be advertised on our Facebook and our website, socialworkfuture.org. You can sign on via Eventbrite to a link, and we'll send you the Zoom codes at a later date. And this meeting is purely for workers to come on and share experiences of what's going on from around the country, and to discuss how we can take things forward. Social Work Action Network is built upon activism and workers and students and academics and pulling that all together. So we would love to hear from workers on that meeting. I'm going to bring in B, and we've had a comment and a question from Alyssa, and it says, COVID has at least demonstrated the importance of a well-funded state infrastructure, but how do we respond to domestic abuse?
Hiya. Yeah, I think that's a really important question, because one of the things that we do know, and again, it's probably being underreported, but we do know that domestic abuse is rising. And on one level, that's no surprise, because we know that one of the problems in terms of family situations is that the door shuts and there's a sense of privacy, and that's been exacerbated massively by the isolation and the distancing that families have had to endure because of the difficulties of the pandemic. I think that one of the problems for me is, one of the good things is, yes, we know the money is there. We've now, found that the government can unlock massive amounts of money when it sees fit to. When it's told us for years that hasn't been available. But where's it going, I suppose, is the key question. And what we know about domestic abuse services is that they've been underfunded for years, and they've been pushed very much to both the voluntary community sector with very short-term funding, and also to the criminal model, in a sense. So now a lot of the services that are available are linked to the victim's ability to press charges and to criminalise a situation where they may not want to do that, they may fear doing that, they may be massive threats. So what I feel we have is a very uncomfortable situation at the moment. We know that domestic abuse is massively unreported, and I do think that part of that is because of the fact that there is a massive amount of pressure for people to press charges and to take it through a criminal route. And we know that the community resources aren't there. So in the numbers that we want, they exist, but they're very badly funded. So for me, one of the things that we should be campaigning on straight away is that we increase funding for all domestic abuse cases. So all those services basically are funded, receive increased funding as quickly as possible, and that funding is guaranteed. One of the other problems is the short-termism of funding around the voluntary sector, where a lot of services know that they may have funding for the next 2 or 3 years, but not beyond that, and that's something that needs to be pushed much wider. I think it needs to be separated away from the police much more, so that there isn't that sense of having to be involved in the criminal justice system, as well as being able to get away from a perpetrator or an abusive situation. And then the other thing is that we need to have money pushed immediately into providing accommodation for victims of abuse, because what we knew last year was that all of the hostels and the spaces were full constantly, and that was without this current situation, which has made things worse. So the pressure now for finding accommodation will be huge, and so there needs to be finance put straight away into accommodation being made available as soon as possible. And I think in the longer term, we have to start saying that this needs to be much more a local authority service. We've seen services coming back in-house that have been privatised or sent out to independent voluntary sectors over the years, because it doesn't work. You have to have long-term planning and long-term funding with these sort of services. And we have some fantastic workers, but they're seriously underfunded, they're seriously underpaid, and they have no job security. Well, that doesn't strike me as sending a very clear message from local authorities or from the government that they take this issue seriously. And that's something we can campaign on straight away and start to change as quickly as possible.
Thank you, B. Okay, so we're going to bring it round to another round of questions. So I'm going to ask Mark, as I said, kind of follows on, and it's principally how will we push through for change going forward after this pandemic?
Great, thank you. I've just come off a 2-day call, Zoom call for disabled people's organisations across England, and we've got a whole agenda. And what we're very clear about is that we can't go back to how it was before. But we don't have any confidence in our government that they won't try to, and their ministers and the cabinet members are still, or are already, saying that people are going to have to pay for this, whether it be self-employed people for their packages or whatever. So we know that, you know, the neoliberal arm of the Tory party want permanent austerity. They want to shrink the state. They think the private sector is the way forward. So we're in a battle. And we know that we have to use a wide range of campaigning tools, from direct action through research, through pressure, through protesting, campaigning, using social media and all sorts of other platforms in our armoury in order to achieve change. But, you know, I don't think there's any optimism amongst disabled people, because, you know, the Tories and their allies in the Lib Dems from the coalition government have imposed, you know, austerity. They've made disabled people and poor people pay for the crisis in the banking system. And we know that, you know, what we're facing is a huge recession as a result of the pandemic. And we don't think this government are redistributive. They're not going to ask the rich to pay for the pandemic. They're going to take it out on the people who can't afford to pay, you know, who have suffered for 10 years. And we think they're probably just going to carry on. So I'm afraid I can't be more optimistic around that one. What we do know is that, you know, the university lecturers were on strike. We think, you know, the trade unions do need to act. We think social workers shouldn't accept what they're being meted out. And we would like to see broader industrial action that disabled people can get behind and support.
Thanks very much, Mark. And I suppose with the experience of myself working with young people with disabilities, it's certainly an issue that's not going to go away, and the cuts that have left people in a state, this is only going to get worse. And as we see an unfolding recession, you know, it's really stark times, and I think it's now a particularly strong point in a time where we have to actually fight back and fight for better services going forward. Ruth, I'm going to bring you in. We've had a question with no name, and it's asking, you know, Black and minority ethnics seem to be particularly vulnerable. What role has institutional racism played in this crisis?
There's been, I think about 30% of healthcare workers, certainly who've died, have been from Black and minority ethnic communities. And overall, there's a massive overrepresentation of Black and minority ethnic people have died in the crisis. I think there are a range of reasons, but the structural inequalities in society around poorer health care, perhaps throughout a life course for people from Black and minority ethnic communities, can play a part. Perhaps the experience within organisations of how protected and how well protected people are, the types of roles that people take on, how exposed people are through working in poorer paid, less protected roles, less secure jobs. All of those things can play a part in the fact that people from different, from Black and minority ethnic communities may be much more exposed than the population overall, because they all lead to people being in more vulnerable situations. So that's kind of structural and structural racism at kind of socioeconomic level, as well as institutional racism potentially within how organisations work. I don't think we know yet. I was listening to the equalities lead for the NHS speaking about this the other day, and talking about the fact that there are going to be a multiplicity of factors. It's a bit like people ask the question, why are black and minority ethnic, particularly black people are overrepresented, say, in the use of the Mental Health Act. There's undoubtedly an institutional racism element to that. Unpicking it and getting to the bottom of it is quite hard. But I think there has to be a full investigation into this, because it's really stark. And if it is to do with underlying health conditions, if there are kind of those physiological and health issues there, then they need to be uncovered, and we need to understand that. We also need to understand what is it about those black doctors who and nurses. And today we heard we heard yesterday actually about a black social worker in Birmingham who's died. We don't know how they became unwell, but we're hearing over and over and over again those are the people that we're seeing, the pictures that we're seeing in the news. So there's something happening here where black minority ethnic people are more exposed. We know, of course, that a lot of the roles that are now considered critical, whether that's working in the NHS, working in social work, driving public transport, all of those things which have been shown to give rise to a lot of exposure, are places where black and minority ethnic our fellow citizens are providing us with those services in high proportion, and so are exposed. So there's a lot of factors, and it's really stark and a tragedy, and really needs to be unpicked. And I'm sure that this is, interrogating this is just not going to go away, because it's so evident.
Thank you, Ruth. Yeah, I mean, it's interesting when you start to hear the Tories out clapping on the streets for the NHS, or they're talking about national unity. They feel like people have a short-term amnesia from the racism, the cuts, the policy they've been put through, such as Prevent, for instance, the counter-terrorism legislation, which has really affected education workers, particularly in England, that people just forget about the impact their policies have had. And from this, as you're rightly saying, you're starting to see the fallout of this possibly. And can we realistically say that this is going to be uncovered or really taken seriously? Who knows? I doubt it from the Tories very, very, really, ever. It's not going to happen, is it? But it's important that folk like ourselves who are involved in organisations, but also various groups and activist roles, that we actually do support other people when we're thinking about how we're going to actually counteract the oppression in society, as well as the socio-economic factors. I'm going to bring B in for what's going to be our final question, and it's not a small one. It's a bit of a juicy one, and we're going to leave it on. And it's Rebecca has asked, should we have universal basic income, and is capitalism to blame?
I suppose yes and yes is the short answer. I mean, for me, universal income is hugely important. The idea that a sophisticated, well-developed society like ours can't ensure that basic needs of children and adults, whether they're vulnerable or not, are being met is ridiculous. It's absolutely absurd. And actually, the whole idea of a universal basic income would allow for people to be able to feed and house themselves and to take care of basic needs that are hugely, hugely important. And that would take a massive amount of pressure off a system that's pushed to the edge anyway. And it would take a massive amount of pressure off families in order to be able to look after the needs that they have. And actually, in terms of things like racism, if you think about the statistics at the moment of who are the victims of COVID, they are disproportionately Black, Asian and minority ethnic people in our community, because they tend to be people who are poorest in our society and who are disproportionately represented in terms of care work, and therefore they're taking the brunt. And again, it would benefit those families and all families in terms of being able to not have to worry, to provide a safety net for them, so they didn't have to worry about being able to feed their kids and clothe them and pay their rent, and all of those horrendous issues that are really coming to the fore at the moment. And I think that the other bit of the question, which is about capitalism, is, yes, I do think that capitalism is to blame. I heard capitalism described recently as the virus. And I think that's really, really true, because I think we live in a system that basically says profits are more important than people. And I think that this is the drive that's behind the idea that we all go back to work as soon as we can. I don't think it's about becoming normal in terms of a social normal. It's about an economic normal. And I think that the drive behind it is about the fact that profits are starting to fall, and the economic system that exists across the world is starting to fall to pieces, because it can't be sustained when there isn't competition and there isn't markets and all those kind of things. And actually, it's really interesting at the moment when you pair back to what we actually need, rather than just all of the luxuries and all the superficial stuff that's pushed at us, then an awful lot of our production is of things that are really not that essential for us. I think the other element of it is that capitalism, because of its drive for profit, has caused the pandemics that have occurred over the last 40, 100 years, because of the fact that they're pushing food production in ways that are far beyond the natural way that food should be produced. Towns and cities are being driven into areas that were being occupied by animals, and allowing human and animal contact in a way that is not considered, is not natural and normal in that sense, and allowing viruses to pass. And climate change is a part of it as well, in terms of the impact that that's having on the world around us. So I do think that capitalism is very much is to blame for what's going on. And I think what we have to start saying is we want a world where people are put before profit. So therefore, a universal system of finance is hugely important, because that gives people a safety net, but it means that they can get their economy running, but on the basis of what people actually need and not what they want to make profit out of. And I think that that's where the state funding for services and public services is so important, and turning round the world, the chaos of the world that we've got, to a world that actually is about what we need and what people should have, whoever they are, whatever the colour of their skin, whatever their abilities, then those things should be put first, and not the drive for profit, which is where we seem to be going at the moment. It's crazy.
Thanks very much, Bean. It's always a tough question. I think that we're going to be rounding this to a close. Mark just wanted to highlight that the disability group DPAC on the website have a pamphlet on universal basic income, in terms of some of the critiques around it and the possible impact that has on disabled people. And it's worth reading, because it is a nuanced debate on how benefits are run and how society is run, and actually some of the finite points. Before we bring it to a close, because obviously it's not long off the 8 o'clock time to clap and chant, or as I say, howl with rage for the NHS at 8 o'clock. I just want to thank everyone who's came on Facebook, who's asked questions. I would ask you to send us them into our Facebook page, because the questions that you're asking are starting to develop some of the online meetings that we're having. So thank you for doing that, and please keep sending them. These meetings have came about from an international meeting that we set up with the International Federation of Social Work and Social Work Action Network. And we've been continuing these, and we've had 2 very successful ones. Next week, we're going to be having another one on social work and social transformation in the time of COVID-19. So that's going to be streamed at 5 o'clock next Thursday. So please join us. Please come and comment, please be involved in the conversation. And I would also please say, stay safe and stay home. Thank you.